Before we begin, I want to tell you about a moment that changed everything in my life. A moment when someone told me I wasn't good enough. A moment that I thought would define my entire career. But what happened next was something nobody could have predicted. Stay with me, because by the end of this story, you're going to understand that sometimes the people we think are above us are the ones who need us the most. And sometimes, being underestimated is the greatest gift of all. My name is Grace. I'm a registered nurse working at Metropolitan Hospital in Chicago, and I've been doing this for 11 years. I grew up in the South Side, where my mother was a housekeeper, and my father worked construction. Neither of them graduated high school, but they taught me something that no diploma could ever give me: resilience. I started my nursing career right after finishing my associate degree at 19 years old. People used to say I was crazy. They said I should have gone to university first, but I knew exactly what I wanted. I wanted to help people. I wanted to be in those moments where life changes for someone. Metropolitan Hospital is located in a neighborhood that's constantly evolving. The building was constructed in the 1970s, and even though it's been renovated several times, you can still feel its age in the walls. The emergency department is where I've spent most of my career. It's loud, chaotic, and beautiful all at the same time. Every single day you encounter human suffering in its rawest form. You see people at their absolute worst and their absolute best. Dr. Marcus Wellington was a cardiothoracic surgeon who had just been recruited from the East Coast. He was known for his impressive credentials and his even more impressive ego. Everyone knew his reputation before he arrived. The hospital was proud to have someone of his caliber, but what they didn't tell us is what he was really like. I first met him on a regular Tuesday morning. I was preparing a patient for his rounds when he walked into the room. He was tall, impeccably dressed, with silver hair, and the kind of confidence that fills an entire room. He barely looked at me. To him, I was just part of the equipment, another tool in his surgical arsenal. I didn't think much of it then. I was used to being invisible in these hierarchies. That moment came about 2 weeks later. We were in the hospital cafeteria, and I was sitting with some colleagues during my lunch break. I was actually joking about something one of my patients said, trying to lighten the mood after a particularly difficult shift. We'd lost someone that morning, and we were all trying to process it. Dr. Wellington entered the cafeteria with a group of his fellow surgeons. They were laughing loudly, talking about golf and investment portfolios. He spotted me and actually walked over to our table. At first, I thought maybe he wanted to ask about a patient. I stood up out of respect, because that's what we were taught to do. He looked at me and said, almost casually, like he was commenting on the weather, "You know, I've been watching you in the department. You seem ambitious, but let me be honest with you. You'll never be a surgeon. Nursing is fine for people like you, but you need to understand your limitations. Some of us are built for leadership. Others are built to follow orders." Then he turned around and walked back to his friends. The entire cafeteria seemed to go silent. I could feel everyone's eyes on me. My face turned red, and I sat back down. My colleagues tried to say something supportive, but honestly, I couldn't hear anything. All I could hear were his words echoing in my mind. What did you think about what happened to Grace in this moment? Do you think what Dr. Wellington said was fair? Leave your thoughts in the comments below. After that day, something shifted inside me. I know it sounds dramatic, but it's true. I started questioning everything about myself. Every decision I made, every action I took at work felt scrutinized, even though nobody was actually scrutinizing me except for myself. I'd be in the middle of treating a patient, and suddenly I'd think about his words. "You'll never be a surgeon." Why did he have to say that? I'd never even told him I wanted to be a beaky surgeon. The truth is, I had thought about medical school when I was younger. I'd seriously considered it, but I chose nursing because I realized I didn't want to be the person making the final decisions from a distance. I wanted to be there with the patients. I wanted to hold their hands. I wanted to be present for the most crucial moments of their lives. That was my dream, and I had made peace with it years ago. But his words made me question if I was somehow settling. Was I a nurse because it was my true calling, or was I a nurse because I couldn't do anything better? That's what he made me feel like, that I was inferior, that my choice somehow reflected a lack of capability rather than a different set of priorities. I started working harder than I ever had before. I took extra shifts. I studied medical journals on my own time. I attended seminars and workshops, always trying to prove something, but I wasn't sure to whom. Was I trying to prove something to Dr. Wellington? To myself? To my family? My roommate, Jessica, noticed the change. She asked me if everything was okay. I told her about what happened, and she got angry. She said he was a jerk, and that he was clearly intimidated by strong women. But that's not how I felt. I didn't think he was intimidated by me. I thought he was just stating a fact about who I was, and that hurt more than anything else. I want to thank you so much for staying with me through Grace's story so far. Your support means everything. Now I have a question for you. Have you ever had someone tell you that you couldn't achieve something? How did you respond? Please share your thoughts in the comments. Trust me, the best is still yet to come in this story. 3 weeks passed. I was still trying to shake off that encounter, trying to convince myself that his opinion didn't matter. But clearly it did, because I was still thinking about it every single day. I was exhausted, not just physically, but emotionally. I was running on fumes and disappointment. Then everything changed when Mr. James Patterson arrived in the emergency department at 2 o'clock in the morning. It was a Thursday, and it had been a relatively quiet night, which in a hospital means the chaotic rush is just around the corner. He came in via ambulance, accompanied by his wife, Margaret. She was terrified. I could see it in her eyes. Mr. Patterson was 73 years old, experiencing severe chest pains and shortness of breath. His EKG showed some irregularities, but nothing that immediately screamed emergency to most of the doctors working that night. He was admitted for observation and referred to cardiology for further evaluation. That's when Dr. Wellington got involved. I was assigned to Mr. Patterson's room that night. There was something about him that made me want to pay extra attention. Maybe it was the way Margaret held his hand, like she was afraid if she let go, he'd disappear. Maybe it was because he reminded me of my own father. He had the same kind eyes, the same gentle voice even when he was scared. As I was taking his vitals, he told me about his life. He was a retired teacher who had spent 40 years in public schools. He had 3 children and 7 grandchildren. One of his grandsons wanted to become a nurse. He told me that with pride in his voice. He said his grandson had watched his grandfather overcome health challenges over the years, and it inspired him to pursue healthcare. I listened to every word. I made notes on his chart, not just the clinical notes, but also the human details, his diet, his stress levels, his family history. When Dr. Wellington came by for rounds, he spent about 5 minutes with Mr. Patterson, looked at his test results, and essentially told him it was probably just anxiety-related chest pain combined with age. Take some medication, rest, and you'll be fine. He didn't seem particularly interested in the case, but something in my gut told me that this wasn't just anxiety. There was something else going on. The next morning, Mr. Patterson seemed slightly better physically, but his anxiety had increased. He kept mentioning that the pain was different from anything he'd experienced before. It was sharp, radiating, and it came in waves. Margaret was becoming increasingly worried, but Dr. Wellington remained dismissive. During rounds, I tried to present additional observations. I mentioned that his oxygen saturation had dipped slightly during the night, that his blood pressure was fluctuating, and that he was complaining of unusual fatigue. Dr. Wellington barely glanced at the monitor. He said, and I remember this clearly, "Nurse, patients often complain about various symptoms. Our job is to distinguish between real pathology and hypochondriasis. This man is clearly anxious about his age and his health. He's interpreting normal aging symptoms as medical emergencies." Then he walked away. What struck me most wasn't what he said about Mr. Patterson. It was the way he looked at me when he said it. There was a subtle dismissal there, like my observations weren't worth considering, like I was just a worried nurse overreacting to a patient's complaints. I felt that familiar sting of humiliation again, but this time, it fueled something different inside me. It fueled determination. That evening, I started doing something I'd never done before. I began researching cardiac conditions that might present with his specific symptoms. I consulted with colleagues who had more cardiology experience. I reviewed his entire medical history, not just the current visit. I looked at his family history. I investigated patterns. By Friday morning, I had found something. His family history showed that his father had died of a massive heart attack at 75. His uncle had suffered a stroke at 68. His maternal grandmother had congestive heart failure. This wasn't just a case of an anxious older man. This was someone with significant cardiac risk factors exhibiting symptoms that, when taken together, painted a very different picture than what Dr. Wellington had diagnosed. I requested that additional cardiac testing be done, specifically a cardiac catheterization and more advanced imaging. Dr. Wellington refused. He said it was unnecessary and would only increase the hospital's costs for no good reason. He documented in the chart that the patient was being discharged with a diagnosis of anxiety-related chest pain and advised to follow up with his primary care physician in 2 weeks. I watched him sign those papers, knowing that this decision might cost Mr. Patterson his life. That Friday evening, I did something that was probably against protocol. I called Mr. Patterson's primary care physician directly. I knew him because we'd worked together on other cases. I presented everything I'd observed and everything I'd researched. I told him that despite Dr. Wellington's assessment, I had serious concerns about Mr. Patterson's condition. Dr. Marcus Reeves listened carefully. He trusted me. We'd built that relationship over years of working together. He told me he would see Mr. Patterson first thing Monday morning and would order the testing himself. He also said something I'll never forget. Grace, your instincts about patients are some of the best I've encountered. Don't let anyone make you doubt yourself. But Monday felt very far away. Mr. Patterson was scheduled to be discharged on Saturday morning. He had already started packing his belongings when I came on duty. Margaret was anxious but trying to trust the doctors. I could see the doubt in her face. She wanted to believe her husband was okay, but she knew something wasn't right. I spent my entire shift watching Mr. Patterson closely. I noticed things that other staff members might have missed because they weren't paying close attention. His breathing pattern changed depending on his position. When he lay flat, he became more short of breath. When he sat up, it improved slightly. His fingers had a subtle swelling that he mentioned had started recently. His sleep had been interrupted because of the chest discomfort. Every single one of these observations, when taken individually, might have seemed minor, but together, they told a story that was completely different from just anxiety. I documented everything, meticulously. I made sure every detail was in his chart, not just the clinical observations, but the context around them. At 3 o'clock in the afternoon, I was about to walk Mr. Patterson to the discharge area, when he suddenly grabbed his chest and cried out in pain. It was different from before, more intense, more urgent. His face went pale, and he started sweating profusely. Margaret screamed for help. I immediately got him back into the bed and called for a doctor stat. My hands were moving, on muscle memory, but my mind was calm and focused. I'd trained for this moment. I'd trained for countless moments like this. I started him on oxygen immediately. I got an EKG machine. I placed an IV line for medication administration. Dr. Wellington was the cardiologist on call that afternoon. He arrived within minutes, and the irony wasn't lost on me. This was his patient. This was the case he'd decided was just anxiety. His demeanor changed the moment he saw the EKG reading. His face went from casual to serious in an instant. What the EKG showed was unmistakable. Mr. Patterson was having an acute coronary event. His cardiac enzymes were elevated. The imaging showed significant blockage in his left anterior descending artery, the very artery that supplies blood to the largest part of the heart. If it had ruptured or completely occluded while he was at home, he would have died. There's no two ways about it. Dr. Wellington ordered an emergency cardiac catheterization procedure. He was moving fast now, making decisions quickly and efficiently, but he didn't look at me. He didn't acknowledge that everything I had said, everything I had documented, had been correct. He was too focused on the case at hand. And honestly, I didn't care about acknowledgement anymore. I cared about Mr. Patterson's life. The procedure room was intense. A cardiac catheterization is delicate work. You're threading a catheter through blood vessels to the heart itself. One wrong move can be catastrophic. Dr. Wellington was skilled, I'll give him that. He found the blockage and deployed a stent to open the artery and restore blood flow. I was in the observation area, watching the monitor, watching Mr. Patterson's heart rate normalize as blood flow returned to the affected area. Margaret was in the waiting room, and I made sure someone kept her informed about every step. She deserved to know that her husband was going to live. Here's what I need to ask you. Where are you watching this from right now? Are you in your car? At home? At work? Please tell me in the comments below. I'd love to know who's following Grace's journey with me. After the cardiac catheterization was successful, Mr. Patterson was transferred to the intensive care unit for close monitoring. The next 72 hours were critical. His body had been through significant trauma. A large part of his heart muscle had been deprived of oxygen for an extended period. We didn't know yet how much permanent damage had been done. I requested to be assigned to his care in the ICU. Normally, I worked in the emergency department, but for this case, I wanted to be there personally. My supervisor approved it. I think she understood what this case meant to me beyond just being a patient assignment. During those 3 days, I monitored everything: his heart rhythm, his oxygen levels, his blood pressure, his kidney function, his mental state. I was there when he woke up after the procedure. I was there when he was confused and afraid, trying to understand what had happened to him. I explained everything carefully and compassionately. I held his hand. I made sure his pain was managed. I encouraged him to rest, but also to move slightly when appropriate to prevent blood clots. Margaret barely left his side. She trusted me completely, and I took that trust as a sacred responsibility. I coordinated with the respiratory therapists, the cardiologists, the other nurses. I made sure his medications were administered on schedule. I watched for any signs of complications. On the 3rd day, Mr. Patterson's condition had stabilized significantly. His cardiac enzymes were improving. His heart rhythm was stable. The imaging showed that while he had significant damage to one portion of his heart, the stent had been effective in preventing complete failure. He was going to survive. He was going to go home to his family. When I told him this, he cried. Margaret cried. I cried too, but I waited until I was outside his room. This was their moment, and I wanted them to have it together. The next morning, I came to work for my shift, and Dr. Wellington was making his rounds. He stopped at Mr. Patterson's bed and spent a significant amount of time reviewing the chart and discussing the case with the patient. Then he stepped out of the room and asked to speak with me in the hallway. This was the moment I'd been waiting for. I wasn't sure what he was going to say, but I knew something was coming. Dr. Wellington looked at me, and for the first time since I'd met him, I saw something different in his expression. Humility. Genuine humility. He said, I owe you an apology. I wasn't expecting that. I had rehearsed this moment in my mind 1,000 times, imagining what I'd say if he acknowledged his mistake. But now that it was happening, I was speechless. He continued, You were right. From the beginning, you knew something was wrong with this patient. You documented details that I overlooked. You made an assessment that was more accurate than my own. And because of your skill, your dedication, and your instinct, this man is alive today. He's going to go home to his family. His grandchildren will still have their grandfather. All of that is because of you. Then he said the words that completed the full circle. You told me I'd never be a surgeon, but you should have been a physician. And I say that with absolute respect and recognition of what that would mean. I realized he was referencing what he had said in the cafeteria, and he was intentionally flipping it. He wasn't just apologizing for his dismissal of Mr. Patterson. He was apologizing for everything he had said to me. I was wrong, he said. I was wrong about Mr. Patterson. I was wrong about your abilities. And I was wrong about my words in the cafeteria. Those words were cruel and unfounded. They came from a place of arrogance on my part, and I'm ashamed of them. Over the following days and weeks, Mr. Patterson made a full recovery. He was discharged with a cardiac rehabilitation program, medication management, and lifestyle modifications. He came back to thank the hospital staff before leaving. He specifically asked for me. He brought flowers and a card signed by his entire family. His grandson, the one who wanted to become a nurse, met me in person and told me that I was his inspiration. Standing in that hospital hallway, watching Mr. Patterson and his family leave, I realized something profound. I had spent my entire career trying to prove myself to other people. I had allowed one negative comment from someone I didn't even respect to make me question my own value and my own choices. But the truth was, I had always been enough. I had always known what I was doing. Nursing isn't about being a surgeon. It's not about being a doctor. Nursing is about being present. It's about using your knowledge, your intuition, your compassion, and your dedication to care for people in their most vulnerable moments. It's about being someone who notices what others miss. It's about being someone who fights for patients even when everyone else has given up. I realized that the hierarchies in hospitals are real, but they don't define value. A surgeon can perform a procedure, but a nurse is there before, during, and after that. Procedure. We're the ones who catch things. We're the ones who notice subtle changes. We're the ones who advocate for patients when they can't advocate for themselves. After Mr. Patterson's recovery, things changed at the hospital. Dr. Wellington actually became someone I respected. He started asking for my input on complex cases. He started recognizing the role that nursing plays in patient outcomes. He started treating nurses as colleagues rather than staff. And more importantly, he became an advocate for nursing within the medical hierarchy. He wrote an article about the collaboration between physicians and nurses in emergency cardiology cases, and he specifically highlighted the role of observation and patient advocacy. But the most important change happened inside me. I stopped trying to prove myself to other people. I started trusting my instincts. I started believing in the value of what I do. I've since taken on a mentorship role for new nurses, and I make sure they understand that they are not second-class healthcare providers. They are essential. My journey taught me that sometimes the people who try to diminish you are actually the ones who don't understand your value yet. Sometimes the greatest act of rebellion against those words is simply excelling at being exactly who you are. I never became a surgeon. I didn't need to. I became something equally important. I became a nurse who saved lives and inspired others to do the same. Thank you for following my story. From beginning to end, I'd love to hear your thoughts about this journey. What did you think about Dr. Wellington's apology? Do you think forgiveness is important in situations like these? Please share your comments below. Also, if you haven't already, please subscribe to our channel. We have incredible stories coming up that I think you're really going to love. Make sure to watch our next recommended video. Your support means everything to me and to all the healthcare professionals sharing their stories here. Thank you for listening.